So an alternative option to jumping right into treatment is what we call active surveillance. So many people have heard about active surveillance for prostate cancer. That's been around for a couple decades. We now know it's very safe and it's one of the most common used approaches for prostate cancer management. That's where kidney cancer is starting to go, and this is now a recommended first-line treatment for patients with low-risk kidney cancers based on their small size. So of course, when a patient hears the word cancer, it's very scary, but what a lot of kidney cancer patients don't understand or aren't aware of is that kidney cancers are actually not life-threatening unless they have the ability to spread outside the kidney. The vast majority of the small kidney cancers do not have this ability to spread outside the kidney. And in fact, they grow so slowly, if at all still growing, that they'll never get to the size where they will be dangerous within the patient's lifetime. In these cases, these smaller kidney cancers, active surveillance becomes an ideal management option. With active surveillance, the tumor is monitored periodically over time without initial treatment, but with the plan to intervene with treatment if the tumor shows any concerning features. So when active surveillance is performed properly, treatment can be initiated in a timely fashion far in advance of when the tumor would actually become dangerous. In this way, we are able to avoid treatment in a lot of patients, some of them for the course of their full lifetime. And we're able to reduce treatment by focusing it on those who need it and by avoiding it in those who don't. Active surveillance is not simply just watching the tumor. It requires expertise to know A, how to monitor the tumor, and B, when to intervene with treatment as opposed to continuing monitoring without treatment. I use predominantly CT scans, but you can also use MRI or ultrasound, and I perform these approximately twice a year on the patients, but in those that are slightly higher risk, we might do a little more often. In addition to monitoring radiographically, we also perform tumor biopsy. So the radiographic monitoring, what I'm looking for there is changes in the tumor size, its appearance, and its growth rate. And with the biopsy, there's two things that we're looking for there. One, to tell us whether it's a cancerous tumor or a benign tumor. The second reason for a biopsy is that if it does turn out to be a cancer, that there are different subtypes of kidney cancer, and the different subtypes of kidney cancers have different levels of aggression and different abilities to spread. So the best patients for active surveillance are those with small tumors, particularly those that are no longer growing or are just growing at a very slow growth rate. So given the expertise required to do active surveillance, it's important that patients seek out an institution that has a lot of experience with this, such as a comprehensive cancer center like Roswell Park.